high-flow nasal cannula has been established as an essential measure in non-invasive ventilatory support for patients with acute hypoxemic respiratory failure, particularly since the COVID-19 pandemic. This narrative review is to present the current evidence of its effectiveness in different clinical contexts. The use of high-flow nasal cannula allows oxygen the flow at the pressure rates, creates a positive pressure at the end of the expiration phase, raises the residual lung volume, facilitates the creating of carbon dioxide, and reduces respiratory effort.
The use of information technology has expanded to include prospective patients, immunosuppressed patients, cancer patients, transplant recipients, and patients with hypercapnic respiratory failure. Available Richard Sugarstaff high flow nasal cannula might contribute to reducing the need for orotracheal intubation and invasive mechanical ventilation. An important point is the use of the Rhodes Index as tool to predict treatment success. Although its use is advised, we should caution this recipe maintains that HFMC is an effective.
One of these first features is that if delivery more pressure CO2 delivery, this is because an increase in CO2 generates an increase in spirit oxygen pressure and also in alveolar oxygen pressure. Its main effect is also important, which is the proper oxygenation. We notice this when peripheral O2 saturation and the partial pressure of PO2 increase. We also generate positive and expirative pressure. This effect greatly prevents the collapse of small airways telectasis and undertrapping. Another important effect is the aids in the elimination of CO2 and reduce ventilatory drive. High flow reduces airway resistance and provides adequate humidity and the heat. This equates to less energy.
Broaden your understanding of the topic. This article expanded my understanding of high-flow nasal cannula by highlighting its usefulness in various clinical scenarios, such as acute respiratory failure, the postoperatory periods, COVID-19 patients, and other critical conditions. It helped me better understand the physiological benefits and the predict index like the Rhodes index and disposition drives. Additionally, that review of multiple studies provide a more comprehensive and evidence-based perspective on when and how to effectively use.
After reading the article about the use of high-flow nasal cannula in critical ill patients, he discovered several new perspectives that I previously did not know. One of the most relevant concepts for me was understanding that not only delivers oxygen, but has very benefits physiologic effects such as creative and sleep positive. Pressure tag heals the alveoli open and optimistic gas exchange. In addition, it was surprised to learn how this.
This article is related to what we have learned, especially in classes, about the different methods of oxygen and therapy and their impact on pulmonary function. Through a theory, I have been able to understand how devices works, like high flow nasal cannula, and work and their therapies of and effects. As well, I improvement my knowledge in gases exchange. Thanks to this article, I was able to complement and reinforce concepts, gain a clearer view of application of in critical patients. Also, helped me to understand the role a physiotherapy could have in a clinical setting.
The first point is physical effects. The high-flow nasal cannula produces several benefits. Psychology effects in patients with respiratory failure it allows precis the life. Generalis positive and expiration y pressure and inspiration. Lung volume and produce oxygen. The second point is clinical benefits. They include significant improvements in oxygenation, a reduction in respiratory effect. Respiratory effect is gesture comfort for the patient compared to their oxygen in the inspiration.